Good afternoon. My name is Jessica Komarovsky, and I'm an undergraduate student at the University of Texas at Dallas. Today, I will be speaking to you about urinary cytokines associated with recurrent urinary tract infection in postmenopausal women. We have no affiliations to disclose. So for some context, urinary tract infection, also known as UTI, is the most common bacterial infection among adult women who often relapse and develop recurrent UTI, defined as greater than 3 UTIs in 12 months or greater than 2 UTIs in 6 months. Previous studies suggest that host inflammation plays an important role in UTI recurrence. However, the only biomarker that currently is used for inflammation is leukocyte esterase, which has a 45% chance of false positive. Therefore, we aim to identify urinary cytokines and chemokines associated with rUTI and define their utility as diagnostic or prognostic biomarkers for rUTI in postmenopausal women. Following IRB approval, postmenopausal women meeting the study inclusion criteria were stratified into 2 cohorts based on their history of rUTI, urinalysis, and their symptoms. As you can see here, in the never cohort, we have no UTI history and no current UTI, while in the relapse cohort, we have rUTI history as well as current rUTI. And in both cohorts, we have 23 participants. Following study design, urinary levels of 13 inflammatory cytokines listed here were measured quantitatively using LegendPlex Human Inflammation Panel 1 made by BioLegend. This assay is a multiplex assay that uses fluorescence-encoded beads and measures the signals via flow cytometry. Exclusion criteria were as follows. Peri or premenopausal women were excluded, as well as women in the relapse cohort with complicated UTI, which includes post-void residual, immune deficiency, urinary catheterization, surgery less than a month before measurement, and greater than stage 2 bladder prolapse. Some summary statistics are included in this table below, including median BMI, median age, median urinary pH, and the levels of these cytokines in the urine. Urinary levels measured in picograms per milliliter of inflammatory cytokines interleukin 8, interleukin 18, interleukin-1 beta, and MCP-1 were significantly elevated in the relapse cohort compared to the patients in the never group. We calculated the p-value using the man-Whitney U-test, and the red squares over here signify the relapse patients, and the never group is signified by blue circles. Urinary concentration of inflammatory cytokines were normalized to the level of urinary creatinine in order to account for variation in water reabsorption in urine. As you can see, the cytokines remain elevated even after normalization to a significant degree, especially in IL-8. We calculated these p-values again using the man-Whitney U-test. In summary, the full change of these 4 urinary cytokines, IL-8, IL-18, IL-1 beta, and MCP-1 remain significant even after normalized to creatinine, as seen by the p-values. IL-8 and MCP-1 are responsible for neutrophil and monocyte recruitment, respectively. IL-18 and IL-1 beta are important in inflammasome genesis and contribute to pyroptosis, which is an inflammation-mediated form of cell death. Our results indicate that the level of measured cytokines was elevated in the relapse cohort in both the normalized and raw values for those 4 given cytokines. Taken together, this data suggests both innate and adaptive immune responses may be activated in the bladders of postmenopausal women with rUTI. In the future, we will employ linear regression models to identify diagnostic biomarkers and perform Kaplan-Meier analysis of collected time to relapse data to identify possible prognostic biomarkers. Thank you for listening.